Good morning, one and all. Myself Arun. I'm a clinical psychologist, just passed out from NIMHANS, Bangalore. So, I have base of Tamil Nadu. I'm from Tamil Nadu, and I would like to thank Dr. Paneerselvam sir for providing this opportunity to talk about an app. So, I'm currently working with three different teams. One is NIMHANS, one is Triple IT Bangalore, and one is Microsoft India. So, we are working on a mental health app which I would like to introduce here, since a lot of technological involvement is being taken place in mental health care and delivering healthcare services. So it's an app called Mindnotes, which is built by mental health professions from NIMHANS. And these are the three different teams who have been actively working on this. Microsoft is the technical partner and the funder, and IIITB is a technical expert, and NIMHANS are the content expert people. And right now it is available only in Play Store for a trial run, and later it will be made available for iOS. So people who are interested or to know about it, you can search in your mobile as Mind Notes from NIMHANS. It will be available in Play Stores. And to just brief about what does this app has is, it mainly has self-awareness kind of tasks, and how a community people can deal with their own barriers in terms of reaching out to the mental health professions. And third thing is self-help toolkit, which has 7 different modules of self-help toolkits which the app has. So the five major things: one is self-discovery, breaking the barriers, coping with crisis, professional connect, where the community sample or the client or the user whoever is using the app are able to connect with the psychiatrist or a psychologist for further inputs. And last one is self-help toolkits. This is the major domain which the app has. And then this app is a end product of 10 years of research work done by the research team. So the research team goes with Paulami Sudhir, Seema Mehrotra, all of these people who are from NIMHANS, from Department of Clinical Psychology. And these are the different research papers which has been published on this app. And to brief a little bit more again, self-discovery is more about like a kind of emotional labeling, how they can explore their own difficulties which the individual can go through, which majorly can cater the community sample, where they might not need an intensive therapy work, where they are psychological minded, where they can treat themselves, and they have very good reflective capacity. They can definitely use this app, and as a profession, you can also refer these sort of contents to the patients who are reaching out to you. So how this works is, it works majorly on stories, quiz, awarenesses, and feedbacks in the which is already inbuilt, and then breaking the barriers, where it talks about how they can reach out to the mental health professions through the technological medium. And there is self-help toolkit, which has 7 different modules and different strategies in terms of handling all of the personal difficulties and crisis situations. It has all the helplines from across all the states, which is valid, which is 24/7, which works. So they can access through those lines. And then the clients or the user can develop their own plans and assistance to deal the crisis situation. And professional connect, where they can able to connect with the professional which is in their closer area proximity. And different resources which also has to resolve myths and facts about the mental illness, different videos, poems on different contents, where individually able to explore their own psychological self. And then why I am pitching into you, the rationale behind that is, you are as we are the user come experts, where you can able to see the content as well as we can be also be the user. So one thing, my rationale for that is, you can refer to the people who are well functioning, at the same time they reach to you as a client, where they are more psychological minded and where they're able to reflect their own self. You can refer this app where it might be helpful for them in those lines. And uh, this is the major view I want to put it about the app name. I want to finish with that. App name is Mind Notes, which is right now available in Play Store, and we have crossed across 1,500 downloads. So our feedback, what we got so far is, it's a lot of content loaded, and it would be better to add a lot more animated videos to guide through the patients. So that is one feedback we got, and we are still working on it in the backend. And how it will be more interactive is, where in the backend we used to send a lot of letters, sort of kind of like checking follow-ups to the patients based on their needs. It will be constantly sent on, and that's all from my side. And I expect your support on this. Thank you. Any questions on this or? Yes, sir. Yes, sir. So it has. Please take your seat. So this takes an similar approach like Manas, and so far I am working on this in the line of uh, how a community can reach out to the mental health profession, and this can be a medium there where they can pass through the barriers. So that is the only major thing where I think Manas is more locally focused. That as far as yeah, so as far as my knowledge, this is what I could explain. Yes. Any other questions? Yes, ma'am. Yeah. Yes, ma'am. So far, please take your seat. So far, we have data around uh, out of 1,000 people who have downloaded, we have from the age of 14 people are there where people able to comprehend and they can use it at, and we have not even checked the lower age ranges. But however, it would be useful for the people who want to explore their own self in those lines. So far the data says that 14 to 70 age ranges we have people who are using it. They feel this is benefiting them. Sir? Yeah. So we do have inbuilt scores on 7 different modules, which I was trying to explain. So the the scores is on like self. Can you change to the slides? Yeah. So these are the 7 different modules where they can go through, which has like self-criticality, mastering the worry, behavioral activation. So on these domains, they do have like a sort of objectively measuring and how is it going through. So it has an inbuilt feature of it. Pause here. Thank you. Thank you so much.